Today we've been talking about the sleeve suction catheter. First off, the most important thing is to always wear your N95 mask because and other PPE. You want to take care of yourself first and make sure that you're properly gowned up. That will be located on your correct mask will be located on your badge. And what I usually do is keep one of them in my pocket so that I always have it on hand. And if I use it, then I can always get another one. So most importantly, what you want to do is you want to talk to the patient, make sure that you let them know what you're going to be doing as far as the suctioning and what the process will entail, making them cough, etc. Right now I'm opening up the sleeve suction catheter, and the, the white part that you see right there is you'll attach that to the suction tubing. You always want to test the suction tubing, making sure that it works properly. And again, this is not a sterile procedure. You don't have to wear sterile gloves because the plastic covering itself is what's going to keep it sterile. So as you see, it comes in a sheath, plastic sheath, and at the very top here, you can see that it's perforated. That shows that it remains sterile. By removing that, then you allow that you can now suction through it with the catheter. So you'll take your suction tubing and attach it to the white part there, and then put your finger on the top, and that's what creates the suction. Before you want to have a slow and deliberate suction, you can actually take up to 30 seconds, and that's actually a long time. That was 5 seconds. So as you can tell, you can really go ahead and take your time because you want to do slow and deliberate pass rather than several passes really quickly. Okay, because that's what hurts is those several passes, is that's what causes the irritation and makes the patient really uncomfortable. So what you want to do is just one or two deep suctions where you really get everything out, and that will help the patient feel a lot more comfortable. So again, once the catheter is inside that sheath, you want to slowly push it out till you can see the catheter. And again, what you don't want to do is like drag it around the chest where it could become non-sterile and things. So you just put out a little bit, put your finger on the white part to create the suction. And so I go down a little bit till they cough, 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 let them know, and then slowly pull out, trying to get all the phlegm and sputum that I can in one solid pass. So as you see, once I pull it out, it remains inside the sheath, it remains sterile, so that you don't have to worry about wearing the sterile gloves. Again, if I have to do a second pass, again, I can just push out and go down slowly and gently. Once I'm down, again, as you can tell, you don't want to go down the whole shaft of the suction. You just enough to make them cough, and then slowly pull out, and that's it. And at that point, you can throw it away and be done with it. So it's really simple to do that, and you can always make sure that your patient's comfortable and not in distress. So this one that I'm talking about here, this is going to be the inline suction. So this is patients that have that are ventilated, and again, that will go to the suction canister, the suction tubing, and you see that there's a little white tab at the end of the, and that's where you'll push it down. And so again, you're gonna slowly go in, same process, not quickly and fast, but slow, deliberate, and then suction and pull it out. And the white tab is what you'll hold down. So if you're looking closely, there's a little black line on there. So you'll push the black line into the throat, but what you want to be careful of is pulling that black line all the way out until it's fully removed, because that shows you that you're all the way out of the throat. There can be times where it remains. You don't want it to be too the black line inside the throat, because then they can't breathe well. Lastly, I want to talk about emergency situation. So what you would do if they're desatting and not coming back up, you would grab the ambu bag, turn it up to 15 liters, and manually ventilate them. Obviously, yelling for help, yelling for the RT emergently, um, and that way they're adequately being ventilated. I think this competency will be great to help nurses feel a little more comfortable and have more options that they can help out if our patients are in distress and RTs aren't readily available.